We have an expert panel joining us, former Congressman Patrick Kennedy, author of A Common Struggle, a personal journey through the past and future of mental illness and addiction, and founder of the Kennedy Forum, Dr. Shairi Turner, Chief Health Officer of the Crisis Text Line, and Victoria Browne, founder of The Hidden Opponent and host of RealPod. Thank you all so much for being here for this really important conversation. Congressman Kennedy, I want to start with you. You have been open about your struggles with addiction, and you write about the fact that your late father, the late Senator Ted Kennedy, was not pleased with your decision to speak out. How did you push past that fear, and why was it important to share your story?
Well, like a lot of his generation, these were very shameful issues. He suffered terribly from the trauma of seeing both of his brothers assassinated. And, you know, my mother suffered from terrible alcoholism, and it wasn't anything we felt we could address because, frankly, it's still the attitude that we can't really fix this problem. And that's the difference between our attitudes from yesterday to today. We can make an enormous difference. We can reduce the number of suicides dramatically if we have this as a public health approach. We could reduce overdoses. We had 200,000 overdoses last year. We never kept in touch with any one of them. And 90% of those people are the ones that are successful later on in overdosing. Why don't we wrap our arms around those people? In other illnesses, we follow them right outside the ER and make sure that they're properly taken care of. We employ chronic-based care. But in addiction and suicide, in major depression, it's acute episodic treatment. In other words, we don't deal with these issues as chronic illnesses. And furthermore, we don't pay for these illnesses as chronic-based illnesses. And finally, we basically don't pay. There's a reason, as a pediatrician, Dr. Turner, that there is 1,000% likelihood that you're going to be out of network if your child's seeing a child and mental health provider versus any other illness where they would find it in network. And that means families have to pay a lot more to get the care for their kids, let alone pay cash, which tragically is the way most people pay for this care.
And we are going to delve into that issue, the lack of access to health care. I do want to stay on basically the big point that you're making. There's no national plan to deal with this crisis. And Victoria, you obviously have been active in the effort to destigmatize mental health. You've talked about your own struggles with depression and anxiety when you were an athlete, Division I in college. What is your message to people, and what should they take from your struggle?
You know, I think there are so many more students now, athletes as well, struggling with mental health than we know. And personally, for me, I felt like I had checked the boxes I was supposed to check. Going to this prestigious college, getting these grades, having a starting spot. We won a Pac-12 championship. Everything on paper and on my social media looked picture perfect, yet I was the lowest I'd ever been mentally. And I wasn't prepared to experience those emotions because the conversation around mental health was so stigmatized that I viewed it as a weakness. And for someone who wanted to be an overachiever, wanted to succeed, you know, in societal terms, associating with weakness or feeling like I maybe would fail in some way if I admitted I was struggling, I didn't want to do that. And that prevented me from seeking help. Eventually, I got to this point where I felt I had nowhere else to turn. I'm grateful I confided in one teammate. That gave me the confidence to then see a counselor for the first time. And then from there, I began learning about the insane pressure all students are under, that it wasn't just me that was this shameful outlier who should feel embarrassed, but really this was a major crisis. And that's really what led me to the advocacy work I do now.
And that's the power of finding community, Dr. Turner. Exactly what Victoria is saying, that she was able to actually open up to someone. We saw a record number of suicides last year. What is going on here? And to the congressman's point, why don't we have a national plan to deal with this?
This has hit us at such a record pace, right? So we as Americans have been dealing with suicide, depression, but I think in combination with the pandemic, with the isolation of the pandemic, we are not prepared on the prevention side. We are not equipping our first responders. And who are our first responders? They're parents, right? Are parents able to have these conversations with their children? I have 2 teens myself. Can you say to your child, you're struggling, I see it. Are you having thoughts of death or dying? Same thing for teachers. Are we equipping teachers, school counselors to be at the front lines for our children?
Well, you talk about being at the front lines in prevention, and I think about social media, exactly what I was talking to the governors about. How should we address that piece of this?
First of all, I love what Governor Cox said. If this were any other issue, we would move heaven and earth to deal with it. In COVID, we responded right away. Everybody inoculation, everybody out there. The longest impact of COVID is going to be mental health.
Yes.
And yet we don't treat it. We had Tony Fauci on there every night on the news. When are we going to get that same level of attention for these issues? That's what we have to do. And I love the fact that Victoria got care. But most young people can't get care. There's not enough providers. And back to the original point, there's no protections to make sure insurance companies and, frankly, the federal government treat these illnesses just like any other set of illnesses.
Weigh in on that point, Dr.
Yes,
Turner.
so access. The Senator Fetterman's story was so powerful, right? Because he's coming forward, he's addressing the stigma, he's talking about his mental health, but he had a place to go.
That's right.
Right? He was able, unfortunately, his black and brown peers, male and female, would not have necessarily a Walter Reed to check into, right? Unfortunately, he did. But there are so many others who do not have access to that level of care.
Victoria, with the last few seconds we have here, how do you spread the word and get better access to care, especially for young people?
Well, I think social media can be part of the problem, but it also can be part of the solution. And I think if we can show up authentically online, if we can, share our own struggles and kind of break up this highlight reel we have going on that's only contributing to this issue, that could make a big difference. That's something I try to do online. And I'm grateful that we have other powerful voices, experts, medical professionals, using social media to share tools, takeaways to help others.
Stay with us. We're going to continue this conversation on the other side of the break.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.